Assalamu alaikum. Welcome to another episode of program Pharmacisttalks, a weekly program in which we talk about medications and health. I'm your host, Dr. Ejaz Cheema, and today we'll talk about a very important topic, high blood pressure or hypertension. So let us first understand what high blood pressure or hypertension means. High blood pressure is often called as a silent killer because it has no symptoms. It puts a strain on your heart and arteries, putting you in risk of stroke and heart disease. So what do the numbers mean? Every blood pressure reading consists of two numbers or levels. They are shown with the higher number first. For example, 140 by 90. The first or the higher number is your systolic blood pressure. It is the highest level your blood pressure reaches when your heart beats. The lower number is your diastolic blood pressure. This is the lowest blood pressure level your heart reaches when the heart relaxes between the beats. So what is high blood pressure or hypertension? High blood pressure or hypertension means that your blood pressure is usually higher than the recommended levels. You probably have high blood pressure or hypertension if your blood pressure is consistently over 140 or 90. So how dangerous is high blood pressure to your health? High blood pressure is a serious risk factor for a number of heart diseases such as heart attack or stroke. So why is it important to take your blood pressure medications? If your doctor has prescribed blood pressure medications for you, it's important to keep taking them as per prescribed because they help relax your blood vessels, lower the risk of your blood pressure, and reduce the strain on your heart. Skipping doses or stopping medications abruptly can have serious consequences. If you have been prescribed them for the first time, it's important to take them at night time just for a few days so that you don't have the risk of falling down, because remember, the blood pressure can drop quite suddenly and you may have a risk of falling down. Most people with high blood pressure have to take these medications for lifetime. I understand some people might be worried about side effects. It is essential to communicate these concerns with your healthcare providers, for example, the pharmacist or the doctor, because they can adjust your medications or suggest alternatives if you're experiencing side effects. But important to remember that never make changes to your medications yourself without consulting your healthcare provider. Medications work best when combined with a healthy lifestyle. That includes balanced diet, regular exercise, and managing your stress. Do physical activity as much as possible. The more the better. Use herbs and spices to flavor your food rather than using salt. Think of it as a team between yourself, your medications, and your healthy lifestyle choices. Regularly monitor your blood pressure at home if possible. This helps ensure that your medications are effectively controlling your blood pressure and allows you to make necessary adjustments as per the advice of your doctor. Remember, you are in control of your health, and if you have any concerns about high blood pressure or your medications, remember to speak to your doctor or pharmacist. This brings to the end of today's episode of program Pharmacisttalks. Thank you for joining me in our crucial discussion on high blood pressure and why is it important to take your blood pressure medications strictly as been prescribed by your prescriber. Please do share this video with others and keep watching program Pharmacisttalks. Thank you.